It's America's fastest growing sport.
Pickleball is a sport that anyone can play. It's a small court, much smaller compared to a tennis court, and you don't need to be in the best shape to play. So it's opened up the doors to a lot of people.
But pickleball's popularity isn't the only thing on the rise. So are injuries related to the sport. UC Davis Health's orthopedic surgeons say they're common.
Some players may not be fully physically prepared to play pickleball. There may not be good warm-ups happening, and then that can create overuse injuries or traumatic injuries.
Dr. Menendez specializes in shoulder and elbow surgeries. He's seen more than a few pickleball players in recent years.
Nice ball.
A lot of the injuries I've seen as a shoulder and elbow surgeon have to do with rotator cuff tears, what we call traumatic rotator cuff tears. You have a fall, you land onto your shoulder, and you tear your rotator cuff.
And perhaps you've heard of tennis elbow?
I've seen a lot of what we call pickleball elbow, which is pain on the outside of the elbow, which is also called lateral epicondylitis.
For Dr. Lee, it's knee and ankle injuries that fill her schedule.
So I'm mostly a lower extremity surgeon, so I see a lot of knee injuries. So worst case scenario, sometimes we see ACL tears from really taking a bad fall on the court. Oftentimes we can see meniscus tears, especially when you're changing, twisting, and pivoting. We also see Achilles tendon ruptures, because again, that stop, go, and push off really hard type injury.
So now that you know what can happen, let's find out how to prevent it.
I think the best place to start anytime you start a new exercise program is to check in with your doctor, right? See if you're physically fit to do so.
I would say it's important to maybe take some lessons, learn proper technique, do proper warm-ups before starting play.
Maybe do some weight training and cardiovascular training so that you're fit enough to do a sport where you're cutting, twisting, pivoting, stopping, going.
And don't forget the shoes.
You think you're in your trainers, you think you're in your running shoes, that's not the right court shoe, right? It doesn't help protect against your ankle sprains or ankle rolls. So having the right court shoes, having the right equipment, I think make all the difference in the world.